Assalamualaikum and very good morning to all the judges and also the viewers. So first of all, what is colorectal adenoma? Colorectal adenoma is a benign polyp that will later progress into the colorectal cancer. So we call it as a precursor of colorectal cancer. So my poster title today is What Predicts You to Have Colorectal Adenoma? Findings from Preliminary Case Study. As we all know, colorectal cancer in Malaysia is the most common cancer in male and the second in female, and it takes around 5 to 10 years for the colorectal adenoma to become colorectal cancer. So my objective is to compare the sociodemography, anthropometry, and also the health behaviors among the colorectal adenoma group and the control group. So my method is I doing a case control study with participant 20 subjects for cases and 28 subjects for the controls, age 60 years and above. So my instrument is I use interview administered questionnaire with the bioimpedance analysis data, and the location of this study is in the endoscopy center of Hospital Chancellor Tunku Mukhris, Ceras, Malaysia. So for the result, as we can see, the anthropometry of the BMI, waist hip ratio and body fat percentage. For the BMI, both group had a BMI of around 25, which is in the overweight group. And for the waist hip ratio, both group also had 0.9 ratio. And for the body fat percentage, the control group had a slightly higher body fat percentage than the adenoma group. And for the age is, as I stated, the mean age is 69 years old for the control, and for the adenoma is 65. And I would like to highlight for the race, there is a significant difference where 80% of the Chinese had adenoma as compared to Malay 29%. And for the education level, 57 of the adenoma group had a tertiary level as compared to control group, which is 43%. And for the family history of cancer, there is a significant difference where 88% of the adenoma group had a family history of cancer. And however, for 40% of them had taken supplement intake, and majority of the adenoma group, which is 69%, are active smoker or had been smoker before this. And for the alcohol intake, 75% of the adenoma group are a drinker. So for my discussion, Chinese might be at risk for colorectal adenoma, maybe due to their type of diet and genes. And having a family history of colorectal cancer may increase the colorectal cancer risk by influencing the adenoma growth or enhancing the formation of new lesion. And increasing BMI may stimulate the inflammatory response, which may accelerate the progress of colorectal adenoma. And also having smoker is associated with 2.5-fold increased risk of serrated polyp in the smoker. So for conclusion, the anthropometric profile for colorectal adenoma patient and control had no obvious difference. And having family history of cancer is a risk factor for colorectal adenoma. And also smoking contributes to the increased risk of getting colorectal adenoma, partly due to the carcinogen in the cigarettes. And also this finding of this study can be applied for risk stratification and modifying the colorectal cancer prevention, including screening guideline in Malaysia. Thank you.